Hello everyone, welcome to Sankalp Learning Solution. Today we are solving the biology KCET fourth session on the chapter third, that is reproductive health. Okay, so without wasting the time, let's begin with the questions. So today we are going to study the topics that is reproductive health, problems and strategies, and the population explosion and the birth control, and third amniocentesis, and fourth contraceptives in that natural method as well as barrier method, and then fifth IUDs, and then pills, and then next sixth the permanent surgical methods for the contraception, that is vasectomy and tubectomy, and seventh medical termination of pregnancy, that is called MTP, and it's sexually transmitted infections, STIs, and then infertility, and then lastly assisted reproductive technologies, that is called art. So these are the topics we are going to cover in the topic. So solve the let's begin with the first question. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the first question. Reproductive health refers to. Dear student, just see the picture here. So you already know that health is very important to each and everyone. If health is not good, so we cannot achieve anything, right? If health is good, we are very good in capable of doing everything, right? So that's why health is very important. But here they are asking, what do you mean by reproductive health? So here reproductive health means it's not only related to the reproduction, so it is an a complete physical, that means a person should be physically fit and fine, and he should be mentally also very fit and fine, and social well-being, that means he should be very well behaved in the social, and then reproductive aspect, that means here related, the person should be ability to produce offspring. So that is considered as reproductive health. Okay. So that means a total well-being of an human being, that is considered as reproductive health here. Okay. So the which sentence, which option is suitable here for the reproductive health definition? So the final answer is here option C, that is complete physical, mental, and social well-being in a reproductive aspects. So first option, absence of disease in a reproductive organ. Not only this is also one of the reason, but only this one is not correct. Physical and mental well-being only, not correct. Ability to produce offspring only, this is also not correct. So total complete physical, mental, and social well-being in a reproductive aspect, the option C is correct answer. Thank you. Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question second. India launched the first family planning program in the year. Dear student, whatever the image you are observing here, so this is what the poster of family planning program, that is what small family is a happy family. So these kind of posters are uh, prepared by the government NGOs, and then they started distributing everywhere in the country to create the awareness of the reproductive health and to maintain the family size for the for the increasing population to decrease that. So our India is the first country to launch this family planning program and set an example in the global population policy. So the year is here, that is the option B, 1951. So the year you should by here, otherwise you will get confused. Just by the year properly so you can easily remember. That is not an difficult. So 19 in the 1951. So for the first time, India launched the first family planning program. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question third. The main objective of reproductive health programs is, dear student, so you know that, so you already studied just a few minutes back, we have studied the meaning of reproductive health or a definition of reproductive health. So reproductive health means what? A total well-being, that means a complete physical, mental and social behavior and also fit in reproductive aspect. So that is what called reproductive health, right? But there will be a more main object, that means, so whenever we are doing anything, so we will be having one a particular goal to goal, right? To achieve that goal, we'll do everything, we'll do hard work, we'll put effort to achieve that goal. So here also there is main objective, that means there is one main goal of a reproductive health program. So what is that? Which option is suitable here? Just read all the option. Promotes large families. Is this correct option? Not correct, right? So to uh, uh, not to promote the large families, India launched the family planning program. So first option is not correct. And to prevent infant vaccination, is that true? No. So that is also not correct. And to discourage maternal health services, no, that is also not correct. Okay. So the correct answer is here option C, to achieve a healthy and aware reproductive society. So this is what the main objective of reproductive health. That is what? To achieve a very healthy and aware, to create aware awareness about the reproductive health. So that is what the main objective of the reproductive health. Okay. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question fourth. Fill in the blank. The Reproductive and Child Health Care, that is called RCH, program was launched in the year. Dear student, so whatever the image you are seeing here, that if you observe here, RCH means what? So child is there and then mother is there. That means it is related to the mother and child. Okay. So this program is launched by our government India to protect the health of child as well as the mother. Okay. So this program is launched in the year 1997. The option B, 1997. So bahar the year and then you can easily remember this. Okay. So the family program is in 1951. The first the program launched by the our government, that is in 1951. And the second program is that reproductive and child health care RCH program in 1997. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question fifth. Match the following. So here there are two columns, dear student. One, the programs which is launched by our government, that is given in the A column, and in the B column, that is launched year is given here, and we should match the correct year with the program. Okay. So first one is RCH, that is reproductive and child health care, and then B, family planning. Just a minute back, we just discussed about these two programs, right? So the first program launched by our government is family planning program. So the year will be 1951. Okay, the first option 1951, that is family planning program. And then RCH, reproductive child health care, that is what, that is second launch program. So that is 1997. So the option B, 1997. So the correct answer is here option A, RCH. In the B option, second 1997. And family planning program, that is option 1951. So the correct answer is here option B, that is A 2 and B 1. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 6. Which one of the following is traditional contraceptive method? Dear student, so already you have you already have studied that our country is overpopulated. That is because, so overpopulated is because to increase in the population our country is overpopulated. So here what that is because here the couples, those who are following the traditional contraceptive method, okay, so it becomes fail because it is traditional and natural way, and there is no 100% result. Okay, so that is why the family size becomes more and more. So here they have given four different options, so we should select the which one is not a uh, which one is a traditional contraceptive method. Okay, so the first option is Saheli. So that is a pill. So that is not a natural way, so it is a artificial way. By taking pill, the pregnancy is prevented here. And then CUT, that is called intrauterine devices. Okay, so that is also a artificial method to prevent the pregnancy, so it is also not a traditional way. And third one, IUD, that is what, intrauterine devices. So that is also artificial one, not a traditional or natural method. So here, in the option C, they have given the periodic subsistency. Yes, this is the natural or traditional method to prevent the pregnancy. So it is a natural or traditional contraceptive method. So it is There are three different methods in the traditional or contraceptive. So the periodic consistency, it is also called as a calendar method. That means if you observe in the image here, so there will be a three period in the menstruation, that is menstruation, infertile, fertile and infertile period. Okay, so here the couple should avoid the intercourse, couple should avoid the intercourse in between 10th day to the 17th day here, so that pregnancy will be prevented here. So that is called periodic subsistency, and it is also called as calendar method. Okay, so the correct answer is here option C, that is periodic subsistency. Thank you. Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question 7. Condoms prevent. So dear student, whatever the image you are seeing here, picture you are seeing here, so it is a structure of condom. And why the condoms are uh, a better contraceptive method? Because here it is very affordable also, and here the main is these are preventing not only the pregnancy, not only to prevent the pregnancy, these condoms are used. Here the main is these condoms are preventing sexually transmitted disease, because these condoms are the condoms will not allow the mixing of seminal fluid as well as vaginal fluid. Okay, so that is how it is preventing sexually transmitted disease in the human being. Okay, so and here it also preventing the pregnancy. If you observe here, it does not allow the sperm to enter into the female vagina. Okay, so that is how it is preventing both the pregnancy as well as the sexually transmitted infections or disease. Okay, so the which option is suitable here? The correct option, the option A, only pregnancy. No, not only it is preventing pregnancy, it is preventing pregnancy, but not only the pregnancy. And only STDs, not. And hormonal imbalance, not at all related to this. So the correct option is here, answer C, both pregnancy and sexually transmitted disease. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 8. Saheli is. Dear student, in the image whatever you are using, that is scent chroman tablet, that is called Saheli Plus, and that is taken once in a week. So it is one of the best contraceptive method. And here there are options given here, so just read these all options. That is Sahelis. First one, non-steroidal oral contraceptive pill, and the second one is steroidal injection. It is not an injection. So in the image only you can observe, you can see that it is a pill, right? So second B option is not correct. And C, copper releasing IUD. IUD means what? Intrauterine devices. That means it is inserted inside the uterine cavity of the women, right? So this is also not a device, it is a pill. And hormone implant. No, this does not contain any hormone. So this is also not contained. So the Saheli is non-steroidal oral contraceptive pill. So the meaning here non-steroidal means it does not contain any hormone here. So that's why it is called non-steroidal hormone. So the correct option answer is here option A. The Saheli is non-steroidal oral contraceptive pill. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 9. Vasectomy involves the cutting off. Dear students, I know that all my students are very familiar with this diagram, right? So this is what the male reproductive structure, right? So here these two are what? Testes, testis, and this one is scrotum structure, right? So if you observe here, which structure is cut and tied here? See, this is the structure called was difference, right? Was different. So here if you observe in the left side here it is cut, okay, and then here in the left side if you observe here, so here it is tied, right? So that is what cut and tied off was different. So it is done to the male. So this is permanent surgical contraception method, right? Done to the male. So the correct answer is here the option B was different. Urethra, that is not correct. So urethra is not a correct option. Epididymis here it is present above the testis, and then seminiferous tubule, not a correct, seminiferous tubule present inside the testis. So here was difference is outside the testis, right? So here was different is cut and tied here tightly. So the correct option is B was difference. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 10th. Tubectomy prevents. Dear student, just a minute back we solved the surgical permanent method done to the male, and tubectomy is done to the female, and that is another method, another surgical method. Okay, so here, so whatever you are observing, that is the structure of what? Female reproductive structure, right? So and here, so if you observe here, which structure it is? This is the fallopian tube, right? Right. So here, fallopian tube, if you observe here, the fallopian mark structure, fallopian tube, the ampulla isthmus region here, cut and tied. Cut and tied. And that method is called what? Tubectomy. Why it is done? To prevent what? So, to prevent the pregnancy. How it is preventing the pregnancy, dear student? So the first option is ovulation. Is this preventing the ovulation? No, right? Ovulation is taking place in the ovary, right? So the what do you mean by ovulation? The release of secondary oocyte from the matured Graafian follicle that is taking place inside the ovary. So it is not inhibiting an ovulation. So A is not a correct option. And the second, menstruation. No, this is also not correct, right? Because the ovulation is taking place means what? Menstruation is also taking place, right? And then sperm formation, this one is not at all related to the female reproductive what? Structure, right? So the correct option is fertilization, right? Here, where exactly the fertilization is taking place? In the fallopian tube, in the ampulla ischemic junction, the fertilization is taking place. And in this position only, cut and tied to the fallopian tube. Tubectomy is what? In the fallopian tube only, it is cut and tied in. So here if you can observe. So that's why it is preventing fertilization. So the correct option is here, option C, that is tubectomy is preventing what? Fertilization process. Okay, thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 11. Assertion. A condom is an example of a barrier method. Reason, it prevents sperm from entering the female reproductive tract. So, dear student, the condom. So, while explaining other a minute back we discussed about the questions on condom, right? So, while explaining that question only, I told you that condom is an barrier method example, right? So, that means it acts as a barrier between male and female reproductive structure, right? So, that is what here condom is does not allow to mix what seminal fluid as well as vaginal fluid, right? So it does not allow mixing of seminal fluid and vaginal fluid, right? So that's how the condom is an barrier, okay? And it prevents sperm from entering the female reproductive tract. Yes, so if you observe here, so it's a vaginal structure of female, right? And here it is preventing what? The sperm is not is entering inside the vaginal sac, right? Vaginal structure. So that is how it is preventing sperm from the entering the female reproductive tract. So both the assertion as well as a reason are correct here. So the correct answer is here option A. A and R true. R is the correct explanation of A. Thank you. Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question 12. The most ideal contraceptive should be. Dear student, you know that our country is, our country people is almost most of the people are here. One is poor and another middle class, right? So most of the people are here poor and middle class. So if contraceptive becomes very expensive, so the most of the people, that means the 60 or 80% of the population people are not able to afford the contraceptive, right? So that's why our government set and rule to develop the contraceptive. So there are some rules, okay? So this contraceptive has to meet all the rules, then only it is considered as what? Ideal contraceptive. Okay, so here there are some rules like it should not be very expensive, not be very expensive, okay, and it should not harmful, that means no side effect. It should be reusable and affordable, okay, and it should not eh, interfere with the sexual desire of the person, sexual desire of person. Okay, so these are some rules. If this contraceptive meets all these rules, then only the contraceptive is called as ideal contraceptive. Okay, so just read all the options here. So which option is suitable for the ideal contraceptive? Okay, first one, reversible and safe, and B, irreversible. Irreversible is not an rule of ideal contraceptive, and then difficult to use, that is also not correct, and then expensive, that is also not correct, right? So the correct option is here option A, that is reversible and safe. That means it is reversible. The anytime you can implement this, and anytime you can remove this. Okay, so that is what reversible and very safe. So this should be very safe and without any side effect. So the correct option A, reversible and safe. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 13. Expand the abbreviation MTP. Dear student, so whatever the structure you are seeing here, what it indicates, dear student, just observe here. So there is one professional hand here, and so with Caesar and another one instrument, he's terminating, he's cutting something inside, right? So here it is baby. So that indicates what? Termination of this baby, right? So termination of the pregnancy. So which option is suitable here for the termination? MTP. This is the word, that is MTP. Okay, so just read all the option here. So first one, male termination procedure. Is that correct? No. Male is not a correct male termination. And then medical termination of pregnancy. Third one, see menstrual treatment program. No, here it is pregnant. This pic is indicating pregnancy, so it is not treatment of menstrual here. And then maternal therapy process. That is also not correct here. So the correct option is option B. That is what? Medical termination of a pregnancy. So the answer option B, medical termination of pregnancy, is a correct abbreviation for MTP. Thank you. Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question 14th. Which of the following is curable sexually transmitted disease? Dear student, we are discussing about here the curable sexually transmitted infection or disease. Okay, so sexually transmitted disease means due to the sexual intercourse or by exchanging blood and all, or using the infected person needle. So these diseases are transmitted from one person to another person. Okay, so that is named as sexually transmitted disease. Okay, so here there are different disease name is given for the option. So we need to find out which disease is curable. Dear student, you should remember one thing here, that is only bacterial infected disease can be curable. Curable, not viral infected. Okay, so this point you should remember. So only bacterial infected disease, the disease which is caused by the bacteria, that is only the curable, not a viral infected disease. Okay, so here genital herpes, that is also caused by the virus. Okay, so here it is also caused by virus. Even AIDS also caused by the virus, and even genital wars also caused by the virus. Okay, so that means curable means here the disease called gonorrhea, that is caused by the bacteria. Okay, so here this disease is caused by the bacteria Neisseria gonorrhea. Okay, so this is caused by this bacteria, so that's why the bacterial caused disease is curable. So here the gonorrhea is curable sexually transmitted disease. So the correct answer is here option C, gonorrhea is a curable sexually transmitted disease. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 15th. Identify the correctly labeled part X in the diagram showing female sterilization surgery. Dear student, I know that all my students are very familiar with this structure. Which structure it is? So female reproductive structure, right? Female reproductive structure it is. Structure. So here in the question only given that it is a female sterilization surgery. So it is an surgical method, right? Surgical method. You know that the permanent contraception surgical method, that process is called what? Tubectomy, right? There are two permanent surgical method. One is vasectomy, another one is tubectomy, right? And vasectomy is done to the male, and here tubectomy is done to the female. Okay, this tube where exactly it is present in the female reproductive part, right? So the X structure here, okay, the labeled X structure, which structure it is? Fallopian tube, right? So here if you observe, here it is tied and cut, that is what surgical method tubectomy. Okay, so here which part is tied and cut? So the correct answer is here The option B, that is fallopian tube. Ovary is not correct because ovary is present here, and then uterus here it is present, cervix here it is present. So the cut and tied part which is indicating what? Fallopian tube. Okay, tubectomy that is done to the female. So the correct option is here, option B, fallopian tube. Thank you. Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question 16th. The population explosion is mainly due to the. Dear student, it's a very general topic, I think. You all are uh, very um what aware about this topic, that is what? Population explosion, right? The population explosion means what? See, already you know that our country is overpopulated. How it is overpopulated? See, there is a woman giving birth to the three children here. So this is how it is overpopulated. Is that only the reason to overpopulation explosion? Is that correct? No, right? There are several reasons. There are several reasons for the population explosion. Okay, the main reasons are, so this is one of the reason, right? That means decrease in the death, or decrease in the death, or giving uh, birth to the more than two childs. That is also one of the reason. But other reasons are also there. Like, see, nowadays we are getting all the facilities, all the hospital facility. Even poor people can also afford, because our government hospitals are giving free medication, right? So free medication is provided by government hospitals. So these all are the reason to cause the what? Overpopulation. Okay. So just read all the options here. Decrease in the birth rate, is that only the reason? No, this is one of the what not this is not a correct. Okay, so birth rate decreases, that will not lead to the overpopulation explosion. And increase in the death rate, so that is also not correct. If increase in death rate take place, the population will become less. And high migration, is that reason? No, high migration is also not only the reason. Okay, high migration will decrease the population. So the correct option is here, option C, that is what? Decrease in death rate. So due to the hospital facility and all uh, uh, care provided to the what? The mother during the pregnancy, so it decreases the death rate. Okay, and infant mortality rates. So that is why we are giving, so we are giving so much care to the pregnant mother, so infant uh, mortality rate also decreasing, right? So that is why our population explosion is getting increased. So the correct option is here, option C, decrease in death and infant mortality rate. Okay, thank you. Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question 17th. Reproductive and Child Health Care RCH emphasizes on. Dear student, if you observe here all the structure, what it indicates, see here, mother is taking care of the child and the profession, well the doctor who is taking care of the pregnant lady, right? So here also the doctor is taking care of pregnant lady, and here doctor is taking care of the child. Okay, so these all what indicating here, taking care of mother as well as child. Okay, so this is what the RCH. Okay, so reproductive and child health care. So taking care of mother reproductive health as well as child health care. Okay, so that is what RCH. So main objective, what is the goal, what is main objective of this RCS? So that what it includes both maternal as well as child welfare. Okay, so the correct answer is here option A, that is what maternal and child welfare. Economic development not at all related to this. Agriculture productivity, this is also not related to this. Political awareness is also not related to this. Okay, so here the correct answer option A, maternal and child welfare. Thank you. Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question 18th. Periodic subsistence is successful only if, dear student, so already you know this method, right? You already have studied the periodic subsistence method. It is also called as calendar method, right? Calendar method. That means what? Here the couple should avoid the sexual intercourse between 10th day to 17th day of day of menstrual cycle, right? So this is what we called periodic subsistency. Then only the couple can uh, prevent the pregnancy, right? So this is what very natural method followed by the many couple, right? So when it is uh, gets successful, so they should avoid 10 to 17th day of menstrual cycle. That means here the couple, they should be very responsible and conscious during the intercourse, right? So that's why, so then only it is successful in preventing the pregnancy, right? So which answer is suitable here? Which option is suitable here? So the option A, ovulation occurs irregularly, not related to this here, and the female is pregnant, not at all related to this. Male partner uses hormone, that is also not related to periodic consistency. So when it is successful, both the partners are disciplined. That means they should be very responsible and they are they should be disciplined. Then only this becomes successful in preventing the pregnancy. Thank you. So the correct answer B. Both partners are disciplined. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 19. Copper ion released by CUT act by. Dear student, already you know that copper CUT means copper T. Copper T. That means it releases the copper ion. So CUT looks like this. It is in T shaped and it is inserted inside the female uterine cavity like this. Okay. And so whenever the sperms get inside the vagina like this. Okay. So this CUT releases the copper ion. Okay. So this copper ion which suppressing the motility of the sperm here. Motility of sperm. So that is how it is preventing the pregnancy. So it will not allow to meet the ovum. Okay, so it will not allow the sperm to meet the ovum. So this is how it is preventing the pregnancy. So copper ion released by the CUT act by how it preventing the pregnancy means which option is suitable here? First one increasing the sperm motility. No, not correct. If it increases the sperm motility, then very easily the sperm can reach the ovum. And destroying the ovum, no, not a correct. It will not destroy the ovum. And increasing the ovulation, not a correct option here. So the correct option is answer C, that is what? Suppressing the sperm mortality. That means it suppresses, it decreases the motility of the sperm. Not decreases, completely it suppresses the sperm motility so that the sperm cannot reach the ovum. Thank you. Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question 20th. The contraceptive lipis loop belongs to the dear student. So whatever the image you are seeing here, so if you observe here, so this is what the lipis loop. Okay, lipis loop. It is also an IUD. IUD means intrauterine devices which is inserted inside the female uterine cavity. Okay, so if you see this, so it is an S-shaped intrauterine device. This is how it looks, right? S-shaped, right? So and here, so the contraceptive, it is one of the contraceptive and it belongs to. See the option A, barrier method. This is not the barrier method. So these are IUDs, intrauterine devices. And hormonal pill, no, it is not a pill. Not a pill it is. It does not contain any hormone here. Hormone is not present. And a surgical method, no, it is not a surgical method. Surgical method are tubectomy and vasectomy, right? So this is also not correct. So the correct answer is here B, that is IUD, non-medicated type. So here non-medicated means, so here it does not have any hormone here. No hormone is present here, so it is called non-medicated type. Okay, so the correct option is here the option B, IUD, intrauterine device, non-medicated type. Thank you. hello every Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question 21st. Assertion: lactational amenorrhea prevents conception. Reason: ovulation is absent during the lactation. Dear student, so lactational amenorrhea, it is one of the natural contraceptive method. Natural contraceptive method, right? So here lactational amenorrhea means what? So during lactation, what happens? During the production of prolactin hormone. Okay. So due to the sucking, prolactin hormone is producing from the what? The pituitary gland, right? So but here due to that, the pituitary gland, it will not producing LH hormone. So due to the lack of LH, so ovulation is absent here. No ovulation. Okay. So that is how it is preventing the pregnancy. Okay. So that is what called lactational amenorrhea. Amenorrhea. That means during 6 months of lactation, due to the high production of prolactin hormone. What happens? There will be no LH hormone and it prevents an ovulation. An ovulation. Okay. So that is called an ovulation. So it prevents the ovulation. That process is called an ovulation. So that is if the couple do the intercourse, so due to the anovulation, so there will be a no pregnancy. So the assertion lactational amenorrhea prevents conception. Yes, it prevents the conception because there will be a no ovulation. Ovulation is absent during the lactation. Yes, during the lactation and ovulation is absent. That is itself is called amenorrhea. So the correct answer is here option option A. A and R are true. R explains A. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 22nd. A couple unable to conceive even after 2 years of unprotected intercourse is diagnosed with. Dear student, what does it indicate? See, if couple is having an intercourse continuously without an unprotected intercourse, without an what any contraceptive, they are having the intercourse, still they are unable to conceive. That means what? There will be a problem, right? So there will be a problem that could be in male or that could be in female also. Okay, so that diagnosed with, so that is called infertility. Infertility. Okay, so if the male is unable to conceive, that a male is unable to produce a healthy sperm, that is called male infertility. And if a female is unable to conceive, then it is called female infertility. Okay, so the correct answer is sterility is a not correct answer. Sexually transmitted disease also not a correct answer, and amenorrhea is also not a correct answer. So the answer is infertility here. So that term is called infertility. Okay, so the correct answer is here option A, that is infertility. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 23rd. The legal act permitting abortion in India is. Dear student, we have already discussed the question related to this aborting the pregnancy. That means what? Aborting aborting means termination of pregnancy, right? Termination of pregnancy, that is what called abortion. Okay, so and it is legally allowed in India, allowed in India with some rules. Rules are applied here. Only in that case, MTP is performed. Okay, so that is called MTP. That is what? Medical termination of pregnancy. Okay, so that is called legal act permitting the abortion in India. So the correct answer is here. See, the family law act, that is not correct, and the population regulation act, that is also not correct, and RCH act, that is also not correct. The option C, MTP act, that is a correct answer. Thank you. Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question 24th. Fill in the blanks. AIDS is caused by. Dear student, you have a idea about this because AIDS is one of the not curable, not curable, not curable and very horrible disease. Horrible what? Sexually transmitted disease, sexually transmitted disease it is. And here it is caused by the one deadliest virus, and that is called human immunodeficiency virus. Immunodeficiency virus. Okay, so this virus is actually directly affecting the immune system of the immune system of the affected person. Okay, so that's why it is called human immunodeficiency virus. Okay, so that is called human immunodeficiency virus. If you observe here, so this is how the virus looks like, human immunodeficiency virus, and it is shortly it is called HIV virus. So the correct answer is here option B, HIV, human immunodeficiency virus. Thank you. Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question 25th. In IVF technology, fertilization occurs. Dear student, see, first you should know the meaning of IVF, right? So IVF means what? This is assisted reproductive technology, arts. Okay, that is called assisted reproductive technology. IVF is an in vitro in vitro fertilization. Okay, so here IVF technology fertilization, in this technique where exactly fertilization occurs. Okay, so IVF means in vitro fertilization. In vitro means what? In vitro means what? Under laboratory condition. Under laboratory condition, right? So that's why here in IVF technology, both sperm and ovum is collected, and then the fertilization is done inside the laboratory. Inside the laboratory. So which option is suitable for the in vitro fertilization here? First one, inside the uterus, not. In vitro means outside. And in the fallopian tube, not at all correct. And in the ovary, that is also not suitable. So here, outside the body, under the laboratory condition. So outside the body, and so under laboratory condition, if you observe in the image here, so inside the laboratory, under all the conditions here, it is performed, fertilization is done. So the correct answer is here option C, that is outside the body under the laboratory condition. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 26. The expansion of shift is. Dear students, so you have studied all the art technologies, that is what assisted reproductive technologies, right? So shift is one of the technology comes under arts. So here GIF means, if you observe in the, if you whatever see you are seeing in the image here, so this is ovary, and then see here in the petri dish, what you are observing here, we have fertilized zygote, fertilized egg, that is what called zygote. Okay, so fertilized egg we have, and here what they are doing with the instrument, with an instrument, the zygote is collected and it is inserted into the fallopian tube here, fertilized egg, right? So that is what we called gypt procedure. That means here a zygote is taken and it is inserted into intra fallopian, intra means inside, fallopian transfer. What they are doing here, they are transferring, they are transferring the zygote here, right? So that's why it is called zygote intra, zygote intra fallopian transfer. Okay, so which option is suitable here, dear student? Read all the option. Zygote internal fertilization, no. Fertilization is already, it is done in the laboratory condition. And Jonah intrauterine fertility test, that is not related to this. Jonal insemination for fertility, that is also not suitable, right? The correct option is here option B, zygote intra fallopian transfer. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 27th. Assertion. IUDs are ideal for women wanting to delay the pregnancy. Reason, they are reversible, long term and highly effective. Dear student, whatever you are observing in the image, okay, so these three are IUDs. IUDs means what? Intrauterine devices inserted inside the uterine cavity of the female, right? So here they are ideal for women wanting to delay the pregnancy, right? So they are, yes, they are ideal contraceptive only, and who wants to delay the pregnancy, who wants to delay the pregnancy, okay, so that is suitable for them. Okay, so the assertion is correct, and they are reversible. Yes, they are reversible. So whenever the women want to remove it, okay, she can approach the professional and she can remove this IUDs. So it can be reversible also. Okay, so it is reversible also. And long term, yes, once it is inserted by the professional, by the professional, then it can be used till 2 to 3 years. Okay, so that's why it is long term usable and highly effective also. Yes, 100% here pregnancy is prevented. Okay, so that's why it is highly effective method also. So both the assertion as well as reason are true here. So the correct option is here option A. A and R both true and R explains A. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 28. The drug Saheli was developed by. Dear students, already we have discussed the questions on Saheli, right? So Saheli is an oral non-steroidal non-steroidal contraceptive pill. Contraceptive pill, right? So non-steroidal means here it does not contain any hormone, okay, but here it has drug drug, okay. So that's why this drug Saheli is developed by the institute that is called Central Drug Research Institute, okay, located in Lucknow. So this is developed by the CDRI Lucknow. So the correct option is here option B, CDRI Lucknow. So whatever image you are seeing here, that is a Lucknow CDRI branch. Okay, thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 29. The hormonal composition of oral contraceptive pills is. Dear students, so here the contraceptive pills are many oral different types of pills are there. So the hormone which is present in the contraceptive pill is, if it is containing hormone, that means it will be containing only the two hormones which is related to the female, okay. So female reproductive part. So that is one is progesterone, and another one is estrogen. These two are pregnancy hormones pregnancy hormones, okay. So that's why only these two composition we can see in the composition of oral contraceptive oral contraceptive pills, okay. So the correct option is here, that is option B, that is progesterone, estrogen plus progesterone. Thank you. Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question 30. The main purpose of MTP is to. Dear student, see MTP means what? Already you have a knowledge about this, right? So medical termination of pregnancy, right? So that is what MTP, right? So when it is done, so already I have told you MTP is done under the legal act, okay, legal act, and there are some rules, okay, then only the MTP is done. When it is done, so when the couple don't want the child, okay, so without the aware of couple, if pregnancy is happen, then it is done, okay, with the permission of couple, so MTP is done. And in another case, like when unwanted pregnancy is there, unwanted means like uh, during what, rape, and then uh, some defect is there in the child, defect in the child, and some threatened to death of mother, okay, only in that cases, only in this specific cases, the MTP is done under the legal act, okay. So here, which option is suitable? Increase fertility, no, not related to this. And then stop menstruation, no, not at all related to this. And increase in the female ratio, no, no, this is not at all correct, okay. So the correct answer is here option B, that is to prevent the unwanted pregnancies. MTP is done under the legal act. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 31st, that is match the following. Dear student, here there are two columns they have given. In the one column, in the first column, there are disease, AIDS, syphilis, and gonorrhea. And in the B column, the virus as well as bacterial names are given here. We should match with the correct answer. Okay, so AIDS. Already you have an idea about what AIDS is caused by the deadliest virus, that is called human immunodeficiency virus, right? So the correct option is here. HIV is correct option for the AIDS. And then second one, syphilis. So this is another disease. So here it is caused by the bacteria that is called Treponema pallidum. Okay. So the correct option is here for the syphilis. Correct option Treponema pallidum. And then third one, gonorrhea. So already I've studied about gonorrhea also. That is also caused by the another bacteria. So that is called Neisseria gonorrhea. Okay. So all the answers given here that is matching with the disease. So the correct option is here. The option B, A1, B2, and C is 3. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 32. Statement 1. Genital warts are caused by the HPV. Statement: HPV infection is linked to the cervical cancer. Dear student, just observe the structure here. That is what the HPV, human papilloma virus structure it is. And here this virus is causing the disease called genital warts. Okay, so the statement 1 is correct. So genital wart, a sexually transmitted disease. So STIS, sexually transmitted disease caused by the human papilloma virus. That is correct. And the statement 2, this human papilloma virus, that infection is linked to the cervical cancer. Yes, this virus is infecting the cervix region of the female, so it is related to the cervical cancer. Okay, so HPV infection is linked to the cervical cancer only. So both the statement 1 and 2, that is true. So the correct answer is here option A, both true. Thank you. Hello everyone, welcome to Sankalp Learning Solution. Which of the following STDs is preventable through vaccination? Dear student, so you may have heard about the slogan, that is what, a prevention is better than cure, right? So when vaccine is given here, so vaccine is given, so here what, this STDs vaccination, that is called HEPB vaccine, that is called hepatitis B vaccine. So that is given to all the infants after birth, after birth before 24 hours. Okay, so this is how this is preventable, even though it is viral causing disease, by giving the vaccination after, immediately after the birth. Okay, so the sexually transmitted disease can be curable. Prevention is taken before the infection only. Prevention can be taken for the hepatitis B sexually transmitted disease. Okay, so the correct answer is here option B, that is hepatitis B, and the image is here, that is indicating hepatitis B vaccination. Thank you. Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question 34. The most reliable surgical method for females to prevent pregnancy is. Dear student, I know that all my students know this answer, right? Because so many times similar type of question we discussed, right? So the permanent surgical method, which one is permanent surgical method, is to prevent the pregnancy, and that is too done for the female. So there are two surgical methods, that is tubectomy and vasectomy, right? So already you know that tubectomy is done for the female to prevent the pregnancy, and vasectomy is done for the male, right? So the correct answer is here, the surgical method which is performing for the female to prevent the pregnancy is the option A, that is tubectomy. Thank you. Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question 35. Identify the device labeled X, small T-shaped structure placed in the uterus. Okay, dear student, so here this is the device structure given here, that is X labeled. So this is the structure of IUDs. Okay, so IUDs means what? Intrauterine devices inserted inside the female reproductive part, right? Like this, it is inserted in the uterine cavity, uterine cavity, right? So which structure it is? If you observe the structure, in which shape it is, it looks like T, right? So here it will be having, so here if you observe here, this is what copper wire here and here, both side it has copper wire. Okay, so which one structure it is, which one iode it is, which one is suitable here in the option? Condom, no, condom is not correct. Diaphragm, no, diaphragm is also not correct. Loop, no, not correct. So CUT, CUT means what? Copper T. T means it is T, it has the structure of T. Okay, so the correct option is here, option B, that is CUT, copper T. Thank you. Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question 36. Which of the following methods is not a natural contraceptive? Dear student, already you have studied the natural contraceptive method, right? There are three natural contraceptive method or traditional method. Natural contraceptive methods are of three, right? So one is, so here they have given withdrawal method, right? And another one is lactational amenorrhea. Withdrawal method means here the male is removing his penis before ejaculation of the sperm into the vagina of female. Okay, so that is called withdrawal method. And lactational amenorrhea. So during the lactation of 6 months, there will be no ovulation. Ovulation. So that is also natural contraceptive method. And then periodic abstinence, that is also calendar method. Till 10 to 17th day, the couple should avoid the intercourse, right? So that is also natural method. And here the use of diaphragm, okay, so that is what the female condom it is. It comes under barrier method, okay, it comes under barrier method. So it's not a natural method, it's not a natural method, okay, so it comes under barrier method. So here, which one is answer here? So the correct option is use of diaphragm is not a natural contraceptive method. Thank you. Hello everyone, welcome to Sankalp Learning Solution. Let's solve the question 37. Identify the correct statement. Dear student, first observe the structure here. So this is an ovum. This is an ovum, and this is what the injection. Injection. Okay. So which statement is correct statement they are asking? Okay. So first statement, ICSI. ICSI means intracytoplasmic per injection. Okay, so that involves the direct injecting of sperm into an ovum, right? And then second option B, gift, transfer the embryo into uterus. No, gift means gamete intrafallopian transfer. That is also not correct. Then gift, here it is zygote intrafallopian transfer. Okay, so this one is also not correct. This here it is they are not transferring embryo. And then IVF always uses donor. No, even in IVF, even they can use their own couple gamete. Okay, not necessarily there is a rule to use the donor gamete. Okay, so this is also not correct. So which one is correct? So this is indicating, so this is an ovum. So directly here, the sperm is injecting into the ovum. That means ICSI. So ICSI involves direct injection of sperm into the ovum. So the correct option is here. Option A, ICSI involves the direct injection of sperm into an ovum. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 38. Assertion. IUDs are inserted by the trained, trained professionals. Reason. Improper insertion may cause uterine damage. Dear student, just see the image here. If you observe the image here, You can easily answer for this question. Okay. So IUDs are inserted by the trained professionals. Yes. See, IUDs are intrauterine devices, right? So we should insert inside the uterus. So here we need a trained professionals. Okay. And so the assertion is correct. And improper insertion may cause uterine damage. Yes, as you can see here, so it is in T shape, right? Okay. So if you insertion becomes improper, so it may cause damage to the tissues of uterus. Okay. So the reason is also correct. So the assertion and reason both are correct here. So the correct answer is here answer A. A and R true. R explains A. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 39. If India's birth rate decreases from 24 by 1000 to 20 by 1000 and death rate from 80 by 1000 to 6 by 1000, the population growth rate will be. Dear student, here we should find out the growth rate. We want growth rate. Okay. What is given here? Decreases from dash to dash. That means here they have given. We need to find out the growth rate. So, okay. We need to minus the birth rate from the death rate. Okay. So if you observe here, the initial birth rate is what? 24 by 1000. Right. And minus the initial death rate is 8 by 1000. Okay. Then if you calculate this, you will get 16, right? 16 by 1000 you will get, right? And then here the final birth rate is given 20 by 1000 and minus final death rate is given 6 by 1000 here. Okay. So if you calculate this, you will get 14 by 1000, right? To calculate the percentage, so here how you are going to calculate? So for this initial growth rate, we should calculate the initial growth rate will be, we want it in percentage, right? So 16 by 1000 into 100. So what becomes? 10 ones are 0.6. So here 1.6 will be a initial birth rate, a growth rate, and then here final growth rate will be a 10 ones are 10 1.4. 1.4 will be a final growth rate. So they are asking here final growth rate, that because here they didn't mention any particularly like initial growth rate or final growth rate. So we should mark here the final growth rate only. Final growth rate. So the final growth rate will be 1.4 percentage. Okay. So this is what the calculation. So the final correct answer is here. Option B, that is 1.4. Thank you. Hello everyone. Welcome to Sankalp Learning Solution. Let's solve the question 40. Identify the odd one. Dear student, here read all the options. So there are four options, right? So IVF means in vitro fertilization. Gypt means zygote, intra fallopian transfer, and ICSI means intracytoplasmic sperm injection, and NTP means what? Medical termination of pregnancy, right? So now just you compare these three are arts. Arts means what? Assisted reproductive technologies. Assisted reproductive technology technologies. But MTP is it is an legal abortion act. Okay. So here arts are treated to the infertility, but here MTP is an termination of pregnancy. Okay. So which one is odd now? So the correct answer is here, students, D, MTP is odd one, because these three are comes under arts and MTP comes under the abortion act. Thank you. So dear student, so today we are ending the today's session now. So till 40th question we have discussed, and the remaining questions we'll discuss in the next fifth session. So thank you.